Since health center needs assessments are meant to inform and improve the delivery of health center services, what are some of the ways you can use your needs assessment findings to inform your health center's strategy and its decisions? One of the main ways is to use your needs assessment in your next strategic planning process. This works especially well if you time your needs assessment to occur right before your strategic plan or in conjunction with your strategic plan. Your needs assessment can help you understand the current demographic, economic, and social environment the health center exists in, and help you assess your health center's internal strengths and weaknesses, as well as external opportunities and threats, which you'll often see referred to in strategic planning as SWOT or a SWOT assessment. And the needs assessment can help you begin to identify opportunities and strategies for responding to unmet need in the community. Um, Things that may end up being either explored more or prioritized in the eventual strategic plan. In this way, your needs assessment can really provide context and background that informs the whole strategic planning process, from mission, vision, values to strategic priorities to goals, objectives, and tactics. Let's take a moment to look at some of the ways that needs data can actually show up in your strategic plan. So take, for example, a health center whose needs assessment showed an aging population in their community. We know this is the case for many health centers. How might understanding that your community has an aging population translate into a strategic plan? So this health center might create an entire strategic priority or focus area just around this, like having a priority devoted to improving access for older adults or being the premier health center for older adults. Or this could show up at the goal or objective level of a plan. Maybe there's not a whole priority area around older adults, but in a priority area around expanding services, there are some specific objectives around adding clinical or enabling services of importance to older adults. In some cases, needs data doesn't shape the overall strategic plan priorities or the goals or objectives, but it might shape exactly how you implement them. For example, if you had a goal of opening a new site, maybe the needs data makes you consider the impact of your aging population on the location or the accessibility of the site. If you have a goal of growing your workforce, you might consider, how does knowing about this changing patient demographics affect the specific provider types that you're planning to hire? If you have a focus on financial sustainability, you might be considering, well, what will the impact of increased Medicare share be on our revenue? There are many different ways and levels that your needs assessment data can ultimately appear in your strategic plan. And there are also many other ways your needs assessment data can be used to inform operational changes and other decisions your health center makes. It can help you plan new or different service delivery sites or expand or change your services, both important parts of your scope of project. It can, influence adjusting your hours or your operations, have you make changes to improve your patient satisfaction, be used to determine and plan for staffing needs, or develop more accurate financial assumptions. It can also help you build new or expand partnerships, and of course, make the case for funding.